Hi, everyone. Welcome. I am Angela Love-Zaranka with Lactation Education Resources. Thank you so much for joining us today, where we're going to have a little bit of real talk, the realities of being and becoming an IBCLC. I have been with Lactation Education Resources for many years as an instructor, and I originally, though, my work was in the community. I have been working in peer support for over 30 years. I've worked in a hospital. I've been an IBCLC for many years, and I am really looking forward to having a little bit of real talk with you today. My co-host today is Dr. Sekeita Lewis-Johnson. Sekeita, you want to introduce yourself?
Yes, good morning, good evening, good afternoon to everyone who is joining. My name is Sekeita Lewis-Johnson. I am an IBCLC as well as a family nurse practitioner and a birth doula. I am an instructor with LER and I've been an instructor for a few years, but I am also the accredited provider program director. And so I am happy to join you. I've been an IBCLC in the hospital as well as working out in the community, just like Angela. So I know a thing or two, maybe, about this thing called being an IBCLC. So I am just so happy that you all are joining us this afternoon.
As am I. So great. So without much further ado, just want to get through a couple of technical things here. So you are welcome to ask questions on the GoToWebinar platform. Excuse me, there is not a chat in the GoToWebinar platform, but if you do have any comment or any question, if you are participating today from your desktop, you can see we've got this blue arrow here, which points to where you can find the questions box. And so it should be to the right of your screen, and you can just click on that and you can ask us a question or make any comment that you would like. If you're participating today from a mobile device, take a look at the bottom and you'll notice the green little circle there, that green arrow, which means that the question list or where you can ask questions is on the bottom of the app. So without further ado, I want to go ahead and get started. I want to mention that if you do have those questions, we have some wonderful support folks who are on the call with us today. We've got Julie Grimes, who is part of our amazing customer support team, and she is also an IBCLC and has worked in the community, so she will be answering some of those questions. As well as if you have any technical questions, we've got the fantastic Jill Stem, and Jill is here to help us with any tech questions that you may have. So please do type in your questions or your comments into that questions box. If you're watching this recording on YouTube, you can post your questions in the comments below, and we do keep an eye on it, so we will do our best to answer your questions. If you need to, you're always welcome to reach out to our amazing customer support staff, which the email address is support@lactationtraining.com. Okay, great. So becoming a lactation consultant, that's why we're all here today. Let's dive in and take a look at what a lactation consultant is and how you can follow your passion and become one. If you become an IBCLC, you will join more than 33,000 IBCLCs in over 122 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners, also known throughout this call as IBCLC. Take a look at their website, which is IBLCE.org. They have different regional offices depending on where in the world you reside or work. Review the requirements and the pathways to become eligible to take the IBCLC certification exam. Well, what do you need to know? There's something called a detailed content outline or exam blueprint, which is based on a survey of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages an IBCLC needs to know in their work. LER's courses cover the entire detailed content outline, and our courses are approved by LARC, which is the Lactation Education, Accreditation, and Approval Review Committee. That's the organization that evaluates and approves lactation consultants training courses. So first, there's a couple of questions to ask yourself today, and I'm going to turn it over to Sekeita, and she's going to be able to walk us through these next few slides. Sekeita?
Thank you, Angela. Yes, there's lots of questions that you will be asking yourself at the end of this, but some questions that may be helpful for you. Before we dive in, some things to keep at the forefront of your mind, and it might be helpful to write these down, is do I have the necessary skills to become an IBCLC? So we're going to talk about some of those skills today, because oftentimes I think when people hear the word skill or skills, they automatically think, okay, it's doing something. I got to do this. And so it's that, and it's a few other things. And so I'm talking about a whole host of communication skills, and we'll get into that. So be cognizant. And so do you have the skills? And if you don't have the skills, where will I get these skills? And so those are kinds of things that you want to write down. So what makes an IBCLC? The first word here is competent. And Angela and I both spoke about working in the community. And, sometimes folks think that when you work in the community, oh, it's just willy-nilly. No, when you work in, you have to be competent. So competency is critical, and it's really necessary to make sure that you are providing adequate and appropriate lactation support. So what it means is that you have the ability and knowledge and skill, there's the word skill again, to do it successfully. And so in a nutshell, we're not talking about, yeah, you have to be an expert. We're talking about you're a novice, yes, but you work your way up to the necessary expert knowledge to be able to serve in a capacity that's helpful to your clients and not harmful. So at the end of your training, you want to be confident that you are doing no harm, and that's why competency is so important. Culturally appropriate, incredible. So let's unpack what culturally appropriate means. If you've worked in healthcare or been around anyone, or even in other business sectors, you might have heard the word culturally competent. And we just talked about competent. Competent means, you're an expert, so to speak, right? The word that I just used regarding competency, think about that. Can you ever become competent in someone else's culture? Some people would argue yes. I would say, no, that means that you've mastered it. And I don't think we can master any particular culture, because there's always cultures within subcultures. So we really need to be clear. And so what we're talking about is language and how important it is to use language. And so culturally appropriate is more fitting for where we want to be. And being culturally appropriate starts with cultural humility. And cultural humility is a lifelong process of self-reflection, meaning looking at ourselves and critiquing ourselves, where we not only learn about other people's cultures, but we start to examine our own beliefs and cultural identities. So that's one definition of cultural humility, but just keep in mind that it is really, it's a lifelong process. I hear sometimes people say it's not in their culture to do X, Y, and Z. So those are things that we're trying to say, you know what, avoid saying those things, because do we really know? So the first part of cultural humility is not feeding into stereotypes, not making assumptions about what someone will do or won't do based on their culture, because you really don't know unless you've been told by that particular person. So culturally appropriate is the individual care that starts with examining ourselves. Along with culturally appropriate is credibility. Are you a credible resource? So when you're asked a question and you don't know the answer, how do you respond? Do you try to answer it off whim, or do you say, well, in this instance, we're talking about lactation. So a lot of people will say, well, when I breastfed, no, we need to know. I'm asking you a question because it relates to a breastfeeding or chest feeding experience. So you really want to have a credible response. Because if you don't, if you just rely on your experience, that may not be the correct thing to do. So being a credible resource means you are giving information, A, that coincides with the best evidence, and B, that you really know what you're talking about. So do you know what the evidence says? And if you don't, do you know where to find it? We're not talking about being like a walk-in dictionaries or a walk-in computer or app in this case, because it's impossible to know everything. But showing credibility is really about, okay, I know enough to say, I really don't know that, but let me go check because I got a resource that I can dig into. So credibility is everything. One of the things that happens if you lose credibility as a lactation consultant or a lactation supporter, that means that most of us will also lose credibility as well. And then people begin to not trust that we really can be helpful to helping them meet their goals. Policy advisor, creator, and advocacy. So a couple other things that we do as IBCLCs is we advise on policy, and we actually help create policies. And that's important to know because from a standpoint of talking about clinical care, remember I said, do you have the skills necessary? So what if you have strong skills in policy? If so, I'm like, yes, we need you. Because as I said before, language is important. The language in policies matter. And so if you're a policy person and that's your thing, you already have a piece of this. But also being at the table to know how policies are created. So maybe it's not your strong suit, but you really want to know how policies are created and how they impact us. And then that then informs your advocacy. That informs a big, 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 big part of who we are as IBCLCs. And a person that's an advocate is simply someone who supports or recommends a particular cause or policy. So even if you're not a policy advisor, so to speak, you can be that person at the table listening to how policies are created to be able to inform next steps. Problem solver and researcher. That's about 90% of what we do as lactation consultants. We usually, when we're involved with helping, it is because there is something going on with the person's breastfeeding experience or lactation experience. So what we do really is dependent on how well we can problem solve or research. So sometimes we get into this mode of one size fits all. And the reason why we're problem solvers is because we know that one size never fits all. And we really just need to problem solve toward individualization to that particular family and what concerns they're sharing. So researcher, when I say researcher, a lot of folks will think, oh, academic, oh, I got to be a researcher. No, not in that sense. So there's two ways to be a researcher. You can be a person who carries out academic or scientific research. And yes, there are IBCLCs who do that, thank goodness. But we need that too. But we also have many of us in this profession and lots of researchers, or you can be a person who is just involved in discovering or verifying information. Let's remember, I said, we're not walking around with everything up in our heads. So we have to know how to solve the problem, what is the best resource for this situation. And that's simply what I mean by researcher on this slide. High-level lactation care and high-level lactation care and skilled care. Those go hand in hand. When we talk about high-level care, I'm going to give you an example of what this means in terms of it being basic, non-complicated breastfeeding care, which is assisting with latch and positioning, essentially the parent and infant are both doing well. There's really no other issues other than they just need a little bit of assistance, versus someone who is an intensive care unit who was lactating prior to being in the intensive care unit, who has a breathing tube intubated. How do you deliver that type of care to someone who's not responsive? Are you able to deliver that type of care? Are you able to look at the medications and say, whoa, this person is intubated, maybe they have a brain injury, or how does that brain injury impact lactation? Are you able to make those connections? So when you're training and when you're doing your training, sometimes it's a lot, but just pause and just always ask, what do I need to know about the brain? You need to know about the brain because it is the level of care that sets the IBCLC apart, that can make the clinical decision making that is appropriate for that level of care. So we're talking about acuity, which is a level of care. Do you have the skills necessary? Now, I'm going to tell you right off, I gave you the worst of the worst, like somebody intubated. That's rare, but the expectation is that you're not going into whatever clinical situation you're experiencing thinking, oh, I've seen it all. However, once you build your skills and you build and build and build in conjunction with enough to say, well, that's not my knowledge set, then you are on your way to developing into the expert lactation consultant. Essential and timely. One of the things that we found out during this current pandemic is the new buzzword, I call it essential. We found out that lactation consultants, IBCLCs, are essential because babies still need to eat. People are still having children, especially during this pandemic, and it's so important to promote and protect the ability to provide human milk. Not just from the bonding and the family, but also from public health and prevention standpoint. So yes, we are essential. And it is important that we show up when they need us, that we are timely, that we can say to folks that we can't, I'm sorry, no, we can't. We can't say to folks, we're in a pandemic right now, so I don't know when this is going to be over. You're on your own. No, it's important to understand we are frontline workers. And so I just want to make that really clear that yes, when we talk about telehealth, yes, that's important too. Yes, that's a skill set. But we really sometimes need to understand that timely access also means sometimes telehealth may not be appropriate. Telehealth prevents us or prohibits the ability to use our other senses that are sometimes necessary. So I want to recall and let you all, I want to share this experience during the pandemic where a baby hadn't been seen by a pediatrician and the parent had been calling and calling and calling for support. And she said, I need in-home support. Well, it turned out that the baby couldn't effectively feed from mom's breast. And the baby couldn't effectively feed from a bottle either. So there were tone issues. So, I come in and I'm like, okay, let's see. And I'm like, whoa, this baby needs to be seen as soon as possible. Now, think about saying to someone, you can't come to them and they tell you they need hands-on support and you run into that. So that's what I mean about being timely. That's what I mean about being essential. We are essential, and it is really prudent and our duty to show up so that we minimize harms that are caused to families, that we are accessible, because that's what becoming an IBCLC is all about. Being able to provide accessible care at the time when it's most needed. Collaborative care partner. I love this phrase so much because what it assumes is that we are collaborating with our clients, which means that we are not the center, we are not the decision maker, we are a collaborator. So remember, it's the families and partners and their goals, their fears, it's their barriers that takes precedence over any goals that we have for them. So I'm saying that, yes, we all know the recommendations, exclusive breastfeeding for 6 months at least. We know these things. And it's important that we still honor those and we still talk about them. However, we also have to understand that we are collaborating in partnership, in agreement, that when someone seeks our care, that we make sure that we approach it in that manner, that we don't overstep boundaries that we're not meant to overstep. And essentially, that's how you become trusted. And in all honesty, you become trusted to do no harm, to be reliable, trusted to say, I see you as a person. I see you, that we're in this together. I'm not superior to you. I'm not higher to you. We're collaborating to do what's best for you. And that's how you become trusted. When you go into certain clinical relationships and you assume a hierarchy, like you're the expert, you go in like, yep, I'm the expert. I know all about this. I've been teaching breastfeeding, chest feeding for 15, 20 years. I'm going to tell you how this should work. That person's going to lose trust, no doubt. When you go in and you touch someone without asking permission, they said, okay, we want assistance with latch. Let them tell you what type of assistance they're looking for before you just go in and touch. That's again how you become trusted. Remember, you're collaborating. You are there as the collaborative person. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So I've talked a little bit about culture. I've talked about collaboration. I've talked about care, the type of care you deliver, and how communication works. And the person is at the center of all of those. And if you want more information, you can visit the Institute of Medicine and you can read a little bit more about patient-centered care, or person-centered care, I should say. But also remember that person-centered care has also become a buzzword. Don't let it become a buzzword for you. Really practice what this model looks like, and then that would further build trust with you, not just with your client, but within your community, and also when you work with other clinicians. So Angela is about to dive into the pathways. But before she gets into the nitty-gritty, there's some additional questions you want to ask yourself. And I'm going to frame it so contextually you can follow along. So there's pathways. She's going to talk about the pathway. But other things you want to consider is, what does the market for IBCLCs or lactation consultants look like in your area? That's very important. The other thing you want to ask yourself is, how does this fit with my lifestyle? Meaning, you know what? This is a journey. I always say it's a journey to become a lactation consultant. It's something that some people can do in 2 or 3 years, some people do in 4 or 5. So you want to think about your family, your job, your commitment, whether you're in school or not. What does this look like? How does this pathway fit in with my life? And that's all an individual thing. You also want to think about the requirements. Do you have the requirements? If not, if you need the requirements, where can you get them? As well as, am I doing this to go into private practice? And again, that goes back into, if you are trying to go into private practice, thinking about a market analysis and what your area looks like. So without further ado, I'll turn it over to Angela to give you all additional information about what this journey looks like.
Great, Sekeita. Thank you so much. That's just so important, how you framed everything and where we're going moving forward and what an IBCLC does. Okay, great. So the process of becoming an IBCLC can seem complicated, but I'm going to break it down for you and provide you with a bit of a roadmap to becoming an IBCLC. First, you need to choose a pathway. Now, we'll come back to this in just a minute. Each one of the pathways has 3 components. It has education, it has clinical hours, and then it's getting ready for the exam. So the first one is the health sciences education. This is the typical education that's necessary for healthcare providers. There are 8 post-secondary or university level courses and 6 general education core subjects. You can find a list for each of the 14 subjects on the IBLCE website. You can search for it, or you can find the link in the resource document, which should be under the handouts in the webinar. If not, don't fret. We will make sure that you receive it via email. The 8 university level courses, and you don't need to write these down now, are biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills, or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. If you took any of these courses during your college career, they count, even if it was 20 years ago. LER partners with Walden University to provide the basic courses. The advantage of working with Walden is that they're online, the courses have been chosen by us, and you can apply for financial aid. The 6 general education subjects are medical documentation, medical terminology, occupational safety and security for healthcare professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. 5 of the 6 general ed courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there is an in-person skills check for this training. Now, I have heard of some organizations providing the training completely online. It's important to check with your local resources. In the resource document, there is a link to the Health Sciences Education Guide. The guide provides general descriptions for typical courses in this subject area. Excuse me, please keep in mind though that the IBLCE is international. The names used in their documents to describe the courses may not exactly fit the description of the course at your accredited education institution. That's okay. IBLCE uses broad terms with the understanding that there is no universal description for what a course in, let's say, clinical research will cover. Why are these 14 courses required? The IBCLC is a standalone credential, meaning you don't need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career, as well as to help you to pass the IBLCE exam. Remember how Sekeita talked about the journey? This is all part of the journey. The second thing you need is lactation-specific education, and this is where we've got you covered. This education should be comprehensive and cover the IBLCE detailed content outline. IBLCE requires at least 90 hours of lactation education and 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. The third component is the lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding, chest feeding, and those families providing human milk for their babies. also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. Now, how many do you need? Well, that depends on which pathway you choose. The amount of clinical experience required to sit the exam depends upon this pathway. The hours need to be accrued in the 5 years prior to applying for the exam. Now, here's a quick overview. I'll review more in depth in the following slides, but Pathway 1 is for healthcare professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Healthcare professionals include physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, Lactation International, the Australian Breastfeeding Association, the Breastfeeding Mother Support Group in Singapore, among others. As of this presentation, there are over 40 organizations that have applied to IBCLC and have been approved. As of July of 2021, LER is included as a breastfeeding support organization. You can find the updated list on the IBCLC website. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education is both didactic and clinical components, and they require 300 clinically supervised hours working with breastfeeding and chest feeding families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. Now, in this pathway, the IBCLC or IBCLCs must be in good standing with IBCLC. Those who choose this pathway must have their program pre-approved by IBCLC prior to beginning their clinical hours. Now, I understand that this is happening relatively quickly now, like within a few weeks. One quick note, for those of you who have breastfed or chest fed or provided human milk for your child, the hours you spent nursing and pumping and helping friends doesn't count towards your clinical hours. Now, while the 500 or 1,000 hours seems like a lot, there's a good reason why. Each candidate needs to have that clinical experience so they can provide that competent care Sekeita referenced while being in IBCLC. If it's any consolation at all, the number of hours, the clinical hours, used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours to sit the IBCLC exam. Now, candidates who are applying for the IBCLC exam through Pathway 1, so this is this pathway, need at least 1,000 clinical hours. For the candidate who is also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation, some sort of lactation care clinic or practice, a primary care practitioner's clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. You may be asking yourself, who is a healthcare provider according to IBCLC? Check out the resource page for the link to the IBCLC website. For breastfeeding support counselors from an IBCLC recognized organization, their hours can be earned in person or online. The location and type of support depends upon the criteria provided by the recognized organization. As of January 1st, these hours are counted on an hour-by-hour basis. So 2 important notes about clinical hours. The first, it's important for you to document the hours as you accrue them. Be very detailed in case IBCLC chooses to audit your application to take the exam. They may want to see your documentation, such as a spreadsheet or other document where you counted your hours. The 1,000 hours do not need to be directly supervised. Okay, so that's what we have for Pathway 1. Now, moving on to Pathway 3, that requires 500 hours of clinical experience, and this experience must be directly supervised by a board-certified lactation consultant or an IBCLC in good standing. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people and those providing human milk for their babies each day, such as a clinic or hospital setting. There's an application for this pathway. It must be planned and approved by the IBCLC before you embark on your program. Now, the hours count towards the 500 hours only when you're actually working with families. The observation hours that you need prior to beginning to work with these families, those hours do not count. Clinical experience is graduated. That is, it starts with observation, then doing a few of these tasks under supervision, then completing the task independently with the IBCLC close by to ask questions and discuss situations before you begin to work independently. I recently had a conversation with Amy Black, who's our clinical internship director, and we agree that most people will spend approximately 75 hours in orientation before you and the IBCLC are comfortable with having you work more independently and begin to accrue the 500 hours. So take a look in your community to find a willing internship site or mentors. You may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 and in order to find those successful strategies and finding a good mentor. If you're interested in this pathway, go to the IBCLC website and download the Pathway 3 Plan Guide. Find a mentor, complete the application, and submit it to IBCLC. They must approve your plan before you can begin to accrue hours. You can start your observation while IBCLC is reviewing your application. Now, LER has an internship program with sites around the US. You can reach out to our internship director to find out more information. Now, while this pathway is an additional step or two, it is worth it. Why? Well, IBCLC reports that students who come through Pathway 3 usually score best on the exam. I believe it's that mentorship that's the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. So a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. The quick answer is yes. The longer answer is paraphrased from IBCLC documents. In part, they say, and I'm going to quote here, so pardon the stilted language. During the SARS-CoV-2 pandemic, IBCLC published specific guidance about attaining clinical hours when face-to-face interactions are curtailed to reduce the spread of COVID-19. The documents are dated 17 April and 6 October of 2020. The guidance provides information on how clinical eligibility requirements could be met by leveraging technology. Now, IBCLC will allow the use of technology if certain parameters are met and allowed by your practice setting and by the IBCLC guiding practice documents such as the scope of practice, the code of professional conduct, and the clinical competencies for the practice of IBCLCs. The key provisions include attention to privacy, security, assessment, demonstration and evaluation of relevant techniques, provision of evidence-based information to clients, as well as appropriate collaboration with or referral to other healthcare providers. Particularly emphasized is Principle 3.2 of the Code of Professional Conduct, which requires advance written consent from the breastfeeding parent prior to photographing, recording, or taping, audio or video, that parent or the child. Another important point about the use of technology for Pathway 3 interns is that there should be observation using technology with two-way synchronous audio and visual components. The focus is on the mentor providing the mentoring and guidance to the applicant. And candidates in Pathway 3 mentorship programs may earn 100% of their minimum of 500 hours of directly supervised lactation-specific clinical practice through technology platforms. Now, this guidance has been extended until 30 September of 2022. It's important to read all of the IBCLC documents listed in the interim guidance. The link to the guidance is found in the resource document in the handout section of this webinar or accompanies this video on our website. Now, at LER, there are two ways to gather your lactation-specific education. Remember that one point I talked about with the specific education? There are two ways that you can get it. One is the Lactation Consultant Training Program, which is the full 90 hours front to back. The other is either core or bridge. They are designed to meet your education needs depending on your background and previous lactation training. First, we have a comprehensive course called the Lactation Consultant Training Program. The LCTP is a 90+ hour course, which is eligible for CERPs, which is Continuing Education Recognition Points through IBCLC, CME, Nursing Contact Hours, and CEs from ACNM. It's intended for those who do not have any lactation education and know they want to become an IBCLC. As mentioned before, it covers all of the topics from the detailed content outline. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices, such as your computer, a tablet, or a cell phone. They are optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we'll update sooner as the new evidence emerges. Have a question for one of our instructors, or you want to discuss a concept with your fellow students? There are several ways to connect to get the answers you need. We have a very active Facebook group for those who are in our 95-hour core, bridge, or exam review course, where our students can meet and support each other along the way. There are people who are IBCLCs in the group as well, and they can also support your journey. Upon completion of the 95-hour course, you are eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam. The Lactation Consultant Training Program is that full 95 hours. Now, if you're unsure of where to start, or if you already have some lactation-specific education, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Our initial course is called Core because it provides you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52+ hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. Now, the bridge course is ideal for people who have the basic lactation education components and need an additional 45 hours to qualify for the IBCLC exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. Not sure where to start? If you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC fuels your passion. I'm excited to announce that we have a 90-hour course as well as our core and bridge course available in Spanish. Capacitacion en Lactancia.com is our sister Spanish website. And so you can receive all of the information that's in either a 95-hour, our 52+ hour, or our 45-hour courses, 100% in Spanish. On that website, we also have handouts for parents in Spanish, as well as many other resources. So if Spanish is your mother tongue, or if you prefer to study in Spanish, please navigate over to this very valuable resource. You can get your content questions answered by experts in the field. Last week, someone reached out to one of our instructors with a question from her own practice. We made the connection with the former student, and the former student received the answer to help their client. Another student had a question about creating policies at their hospital, and we found an appropriate instructor to answer the question and provide additional resources. Several members of our customer support staff include IBCLCs. They get it. They know that journey. They want to support you. We have tech support available 7 days a week. You can get your questions answered about the content by the experts which are in the field and actually doing the work today. And we want to provide you with whatever ongoing support you need as you work on your lactation career. So thank you very much for your time today. Now, I'm curious, what questions do you have for us? Sekeita, have you found anything out there?
Yes, Angela, we do have a question that I thought was great for the good of the group. And the question is, what options are available for individuals who are unable to find an IBCLC to mentor?
So that is one of the biggest challenges and one of the biggest barriers of the profession, is to find somebody who is able to mentor you. And I would say that in those situations, do consider pathway one. In other words, try to vision and find a way to do this work without being directly supervised by an IBCLC. But you know, Sekeita, as you said in the beginning, it's really important to know your resources. And so doing that market analysis to find out what other resources you have in your community, such as IBCLCs and other lactation support providers, is a great way to figure that out. I would also suggest that take a look at that list of breastfeeding support organizations. As I mentioned earlier, LER is now a breastfeeding support organization, and we currently have a pilot program in order to try to see if LER can expand the support that we offer to folks who've taken our 95-hour course and who do want to become an IBCLC. So you can reach out to us and we can provide you with more information about this pilot program and whether or not you qualify in order to be in the pilot.
I want to add to that as well is that, when you're doing your analysis, link up with those that are like-minded, link up with, for instance, if there's any local breastfeeding coalitions or support groups or people that are doing the work that you may not necessarily be aware of. Really do put some thought and some efforts into finding the people that are close to you. The other thing I want to offer is that, online mentoring is great. We have so many resources available at our hands. Like for instance, even discussing via telehealth or I'm sorry, not telehealth, online, but having access to someone who can help guide you along the way may not necessarily be in your same city, in your same state, in your same town, maybe not even in your same country. But online allows the ability to be able to reach out and touch and to really kind of make getting a mentor just a little bit easier.
Very true, very true. That's a really good point, Sekeita. So now in the chat, in the questions, I'm sorry, there is a wonderful question that I would love to answer together. And as I scroll up and find it, because they asked a very good question, which is, here we go. What efforts exist to diversify the IBCLC profession? How do IBCLCs join in efforts to create opportunities to ensure that the IBCLC reflects the diverse communities throughout the nation? That's a really good question. And I want to say that it's not in the United States, but it's around the world. In other words, it is important for those of us who are offering lactation support, those of us who are IBCLCs, to reflect the diverse populations in which we serve. So Sekeita, I mentioned already that LER is now a breastfeeding support organization. That's one barrier that we are striving to remove for folks so that those people who are in the community can get the skills that they need in order to become an IBCLC, even if the closest IBCLC is hundreds of miles, if not thousands of miles away. So what else are we doing?
So I would say, speaking from a diverse angle and also speaking from Representation Matters, I would say that there are various organizations across the United States that are doing work in this area. really, as we think about the cultural appropriateness of care that I spoke about. And so when we think about Native populations, I know some people here in Michigan who really are trying to, diversify and have more Native, and we had to think about it, especially here in Michigan, like, do we have any Native American IBCLCs in this area, and what is that, how do we do that, right? And so I would say that there are a lot of organizations that have a mission to be able, that are doing this work. So there are efforts. I would also say that ILCA, which is the International Lactation Consultants Association, I believe, ILCA, yes. They also have a statement, and that is the international body, as far as one of their strategic goals to really diversify the profession. And so there are some efforts to do this thing. Now, could there be more efforts? Absolutely. So if
Always.
you're, so if you have some ideas, a lot of times and I always tell people, if you have an idea about your area and you feel like that may be an issue or a concern in your area, by all means, you are the person to lead. So I just want to throw that out there, is that yes, there are efforts, but there is room for so much more. There's a lot of work to do.
There's a lot of work to do, that's right. And, not only is LER now a breastfeeding support organization, but we also have scholarships available. Last year, we did a Latinx one for people living in the United States. And actually, I know we had applications from around the world, people whose mother tongue is Spanish. We also have a Black scholarship, which will be available. I believe we have 2 of them that are going to be available this year. So do keep an eye on our social media as well as on our website, and we will announce when those applications will open. And I would also suggest take a look at our diversity statement. Diversity at LER is an action word, and it's something that we are striving towards. Every single member of our staff strides towards every single day that we work. And so please do take a look to see the efforts that LER is doing and that we continue to do every day, and see if it's something which fits with your definition of what our IBCLC is doing in order to diversify our profession. So thank you very much. That's a really great question.
Yeah, Angela, I also want to add, one of the greatest joys and what I enjoy doing is we do partner, we have diversity partners. And I have loved every minute of being able to educate, and be in fellowship with growth and learning in the profession with our diversity partners. And so, yeah, they're, like Angela said, these are action words. And so, I don't want to keep speaking about it. We're just going to keep doing the work, but we need you to do this work as well. There's still so many people who could be helping.
So Sekeita, okay, now you just got me thinking about something else that we're doing, which is that we offer special pricing for our core course for community-based organizations which want to get more and train more lactation support providers in their community. And it is super discounted. It's for organizations that have a cadre or cohort of people that they want to train. And so we have created the special pricing in order to make that happen. So if you want to know more about that, you can reach out to us at the email address here, and they will funnel the questions, any of your questions, to me on that aspect. So there's another question which is here. What is the fastest way to complete Pathway 3? Well, 500 hours is 500 hours. And so it really depends upon you. And, like Sekeita mentioned in the beginning, what does your life currently look like as far as family obligations, personal obligations, work obligations, community obligations? What does that look like, and how much time can you actually devote to the study as well as the support of families? It will take you 500 hours now that IBCLC is requiring sort of an hour by hour accounting of the hours that you spend in support of families. And so it is going to take that much time. A full-time job is usually 2,000 hours per 12 months. That's 40 hours a week, 50 weeks a year. And so if you're working full time, it's 2,000 hours. So if you're working full time on this and are able to see people every single day for multiple hours every day, then you're going to get to your goal quickly. But if you know, for example, let's say, oh, I don't know, something like a pandemic comes and you're unable to do that work that you want to do, then indeed, it may take you a little bit longer. And so do plan accordingly as far as getting through those number of hours. And remember that it is part of the journey. Anything else to add, Sekeita?
No, I love that this person seems real ambitious, the fastest way. So I would also add that, in light of the pandemic, there has been some issues with getting clinical hours, trying to be safe and trying to keep ourselves safe, our family safe, as well as the community safe. So what I would say to that is, um, while you're trying to do this, at a speed that is going to make it really beneficial for you, also think about, getting those clinical hours, but also making it meaningful that yes, it's fast, but also this is quality clinical hours and I am learning the skills necessary.
Very true. Very true. So there are a few more questions here, Sekeita. I'm going to
Yeah.
keep going. If you see one that
Okay.
that you think,
I'm looking as well. Yep. Go ahead.
okay, great. So another question that somebody asked is what's recommended to prepare for the exam? And so I think that it's important for you to go back through your notes. If you took our 95-hour course, make sure that you're taking notes throughout. And so you're going to want to review that if you still have access to the courses. Our LCTP core and bridge courses, you have 1 year of access. So you can go back and go through the information again and take copious notes. Another thing that you could do is we also have an exam review enriched program, which provides the outlines for all of the detailed content outline. It provides sort of a high level overview in each one of the topics in the detailed content outline by subject. And so development nutrition, maternal pathology, infant pathology. So it has all of those different aspects, legal and ethical issues. And so you can go back and look through that and you can take that, and that's a separate course, but you can take that course, and also access to our exam review and our exam review enriched courses provides you with over 500 sample questions. And so you can take those questions in QBank, and that way it can assess your performance, and then you can find ways to improve. Also, there are a couple of textbooks that you may want to purchase and or borrow from a library, and those textbooks are listed in our content, and you actually can get a discount on many of the textbooks from our website. So we've partnered, once again, to remove another barrier, we've partnered with certain publishers in order to provide a discount to our students. And so please do check out the books and see which one works best for you. Take a look online in some of the study groups. Online study groups are a fantastic resource, and they can provide you with additional information as well. So thank you for asking the question.
Yeah, Angela, there's one more that I think that is important to answer, and is the CBS globally recognized also, or more specific to the US?
It's a great question. And indeed, it is something which we have students all over the world. And so I think it depends on your geopolitical region as far as whether or not you've ever met another CBS. And so do take a look around. I mean, in our pilot program currently, we have people who are all over the world in this pilot program, as well as I interact with CBSs on a regular basis from everywhere. Singapore, last week I was chatting with somebody in Singapore. Yesterday I was chatting with somebody in Pakistan. I also, interact with folks who are in Great Britain. There's one CBS who is immigrating back to their country and are also going to stop by in Spain for a wee bit. And so India, we actually have a program in India. And so we do have CBSs who are all over the world. And so yes, it is something which is available everywhere, but do check in your locality as far as if there are any additional requirements in order for you to actually begin serving families.
The other question is, I am a breastfeeding peer counselor. I was hoping you could guide me on how or where to record the hours.
That's a good question. And so I would say it's good if you can, just sort of, you can just keep track of it yourself. However, on the IBLC website, they actually have a calculator. And the advantage of the calculator is, let's say that you are a breastfeeding counselor, but you also work in another capacity in that same job. And so let's say that you also counsel people on car seat safety, let's say. And so in the time that you spend, let's say in a typical day, how much time do you actually spend on just breastfeeding, chest feeding information, and how much of your time do you spend working on car seat safety? And so on the IBCLC website, you can download this hour tracker, and you can sort of calculate for yourself. It's got the formulas in the cells. And so you can calculate for yourself exactly how much time. And IBCLC does, if you're going through pathway 1, IBCLC will sort of take your word for it, that let's say 20, 30, 40% of your time is spent doing this. However, they may ask, if your application is audited, they may ask you for your supervisor to sort of sign off and to attest to the fact that yes, 30% of their time is actually spent with some sort of lactation support.
Yeah. And then I guess there's a couple, but this one is very important. It says, if I already have my CBS, but it expires in a year, do you suggest I restart with the CBS training again?
There's a long answer to that question. Sekeita, I don't know if you want to answer it or if you want me to tackle that one.
Please do.
Okay, it depends on how quickly or how many clinical hours you need. It depends on all the things, right? So just having the CBS, which is great, if it expires in a year, then do you have all your clinical hours through some other setting? And if the answer is yes, then I would suggest taking the bridge course and then moving through it as quickly as you can. If though it's going to be longer than a year before you can either attain your clinical hours and or finish the bridge course, then it may make sense to go back and do the CBS. And what may be more cost effective for you is to take the lactation consultant training program, that entire 95-hour course. And the reason why is because then you'll have access to the content for that year. And I will say our content is updated on a very regular basis. In other words, a course, as a matter of fact, just now, we have a course on engorgement and mastitis. Sekeita, you know this because our instructor, Nikisha Killings, is updating the course right now. And so Sekeita and I, over the past few days, have reviewed the content and said, thanks, Nikisha, thank you so much for providing this information and this update. And so we're going to update it, and therefore it's going to be new and fresh in our lactation consultant training program, as well as I believe it's in our bridge course sometime in the next few weeks. Trauma-informed care is another one that I just asked our content team to upload one more slide, because there's a new tool, there's a new resource. And so we can easily add just that one resource and that additional information into that content. And so we're constantly updating it. Any other comment about that, Sekeita? I know.
No, you did. You did justice. A lot of the questions are so varies depending on where you're at along the journey. And so thank you, Angela, because you did it succinctly. So
I do actually have if it's okay.
Hi, Julie.
Hi.
Please.
I was just going to simply say it depends on how she got her CBS. Did she do it through a core course, or did she do it through a 90-hour course? Because if she did it through a 90-hour course and she's got everything already, then all she needs is the 5 hours of communication skills, if she can get that in really quick. However, if it's a CBS course only, then yes, follow Angela's advice.
Thank you so much. That's perfect. That is perfect. Let's see, somebody else asked, and I can't find the exact question, but basically somebody asked if they're doing some work through pathway 3 and have a certain number of hours through pathway 3, and now they want to be able to use the fact that they're with an affiliated breastfeeding support organization, and if they can get those hours through pathway 1. And here's the thing is that IBCLC wants you to pick a pathway and stick with it.
Yeah.
So you can't mix those hours, unfortunately. And so if you already have those 250 hours through pathway 3, you may want to continue it. Otherwise, you'll need to start from the beginning with the pathway 1 in order to get those 1,000 hours. I'm about 85% sure that I'm right on that one. You can always reach out to IBCLC and ask. What do you think, Sekeita? You think I got that one
Yeah,
right?
I would say that reach out to IBLCE, because sometimes if you write them and give the specific example and the rationale as to why, sometimes you might get a response that might be favorable. And so I would just say write them to just see, if that's possible.
Yeah, that's true. Okay, great. Okay, I think we've answered most of these questions, but there's one here that I kind of was hoping to save till the end. If something else comes in, we'll answer it, of course. But somebody is asking, what motivated the speakers to become lactation consultants? What are the rewards and the challenges?
I'll go first, Angela.
Okay, okay, cool.
What motivated me was my inability to help myself. I was working in maternal child health before I had a child, and I was teaching all book stuff. And so this gives you a little bit of time frame in 1999 or 98, in 2000. I recall teaching that the baby needs to eat 20 minutes on each side, and if the baby doesn't eat 20 minutes on each side, I wasn't a good feeding, and all of these things that when I got home after having my own child, she was 7 minutes and done, and I was at the pediatrician's office. So challenges in not having support and feeling like I wanted to give up, but I knew that I couldn't give up. For a personal reason, I couldn't give up. I just had to keep going. And so it was the challenges. And then after getting over all of those challenges, having another child 6 years later, and then having challenges again, I'll never forget. It was like 3 o'clock in the morning. I was trying to find a CLC. And because I'm thinking to myself, like, what if I can't help myself, how can I help my patients? And working in maternal child, that's a significant part of the job responsibility, is to assist with lactation and to be able to assist in a meaningful way. And so really and truly, that is what motivated me, was being able to become my own problem solver, but also seeing other people who would also seek me for this assistance. And I realized that the more I knew, the more I didn't know. And I just needed to know. And I just needed to be more helpful than harmful. And so really a personal growth thing, but there's lots of backstory, but I would say the motivation came from knowing that I wanted to breastfeed my daughter and having challenges.
That's a very good point. It's very true as well. And it's interesting, coming from that, it was that personal piece, and that's exactly what happened with me as well. With it was because of my own personal experience and realizing that, the help isn't here. But more importantly, when I finally did find help, it was something that, oh, well, now that I know this, then, and other people would come to me just simply because I had overcome many challenges, many difficulties, and was able to meet my infant feeding goals. And so then other people would come to me, family members, friends would ask questions. And that's when I realized that there's more to it than just helping a baby to latch to the breast. And I remember friends of mine used to laugh when I would say that I was going to a breastfeeding conference or a lactation conference for 5 days. And they would say, what? Why are you going for 5 days? They just couldn't understand it. But when I started to understand the science of it, as well as the fantastic evidence behind that peer support, that's when I said, oh, there's just so much which is here. And I just wanted to share it. I wanted to spread the word. I wanted to share it and support people and offer this respectful care. As I say to folks all the time, it's not about me and my, experience, it's about you. And so how can I support you upon your journey? And it's a matter of providing them with the information that they need when they need it, because there's a heck of a lot of lactating people and breastfeeding, chest feeding families, those providing human milk for their babies. all around the world. So there's a lot of people who are out here, and so we need more people to support us and to reflect the communities that we serve. So that's the reason why I got into it. Some of the challenges, of course, are, hearing things from folks about, the care that they may have received or the misinformation they may have gotten, seeing some of the things online, which are just not accurate at all. That's some of the challenges that we all face, Sekeita, right? I mean,
Yeah, I would like to add to that. I think understanding for me, the working in a hospital setting and understanding what maternal and child health practices are supposed to be versus what they are actually, is a challenge. And I would say that keeps me grounded and motivated. And when I say we have a lot of work to do, we do have a lot of work to do. And so, yeah, I would say that I think advocacy keeps me motivated because I do understand the challenges and the barriers. And so, because of that, I understand that when a person is discharged from the hospital, having not received the type of care that we say is best practice, that they need help now because it is timely. And really and truly understanding also that, human milk is the first organic food. It's the first organic. And so now we get all off into, I always question whether organic strawberries are really organic or if they're just labeled as such, right? We know that human milk is coming off the tap. That is organic. So, anyway.
Always straight from the tap. Yep, and from a bottle.
Exactly.
If
But
possible, if possible.
yes. But when you learn more about the miracles of human milk,
It's amazing.
it keeps you motivated. I can't even, every time I find out something new, I'm like, wow, I'm glad to be doing this work. I'm glad to be, a lot of times, and let's keep it real. Let me keep it real. A lot of times when people sometimes when they see lactation consultants coming, they're not happy because we are strong advocates for human milk for human babies. And sometimes that can look different to that person when you're such a strong advocate for doing best practices, for really making sure that we are helping people to meet their individual goals. And so also to the flip side of that is sometimes a person may have a goal and because of a lot of other health history and exam and that they may not be able to exclusively feed human milk, but how can we help them in whatever ways we can help them achieve just a little bit of their goal and make it okay. And so, this is the good, the bad, the ugly of all of it. There's a span of it. Yes, it is miraculous. It's right off tap. It's organic. But advocacy, with any advocacy, it's a fight always. And so be prepared. You're usually not fighting with your clients. You're usually fighting with the systems that are creating barriers. And that's what's real.
That is very real. That's true. And so I will end on this question, which is, what's your best advice for everyone pursuing the IBCLC credential?
My best advice is to stay with it. If this is something that you are passionate about, exhaust your resources, stay with it, don't give up.
Stick with it. And it's all in the journey, right? I mean, I've been doing this for so many years. I learn something new every single day, every day. And so if I were to sit the exam now, after everything I know versus when I was much, much younger, then I know that, I would do better. Every single day, I do better. When you know better, you do better. And that's exactly what I want to say is, yes, there may be challenges. Yes, there may be barriers. Try not to get discouraged. Just keep taking each footstep on that journey. So
I love that advice. Keep taking each footstep on that journey. I love that, Angela.
thanks, Sekeita. That's great. Well, thank you all very much for joining us today. We sincerely appreciate it. We'll stay on for like maybe another minute. And this is being recorded. There are the handouts which are available. If you need anything else, please do reach out to us at support@lactationtraining.com. And we sincerely appreciate your time and attention today. Thank you very much.
Thank you.